More sectors of San Diego's economy open up. It almost feels like we are getting back to normal. But before you throw out the safety precautions, a new report finds that even more reason to continue to social distance and wear a face cover. Fox 5's Misha DeBono explains.
Yeah, this virus once again proving how insidious it is. We've known for a while that those without symptoms can spread the virus, but now we're learning those without symptoms actually are turning up having internal damage to their organs while they feel just fine.
3 studies that have looked at asymptomatic people. And interestingly, although the people look and feel fine, when researchers do a CT scan, do an image of their lungs, in 50 to 100% of the cases, they actually find abnormalities.
A new report by Scripps Research looking to better understand the spread of coronavirus by people with no symptoms made a startling discovery.
When they look at the CT scan, it looks kind of hazy. It looks like you're looking through a dirty piece of glass. What that means is there's something abnormal about the lungs.
Daniel Oran was one of the report's authors. Analyzing data of coronavirus patients from around the world, they found 40 to 50% of people who tested positive are asymptomatic.
We know probably about half of all infections are spread before people have symptoms. So it's important to know that distinction, but the truth is that whether you are asymptomatic or pre-symptomatic, when you look and feel fine, you still can make others sick.
It's important information now, as many are letting down their guard as the economy reopens and it feels like we're getting back to normal. But that, says Oran, and Governor Newsom reiterated Monday, would be a dangerous mistake.
It was the second wave where things peaked because people said, we've got this.
This disease is 6 months old at the very most. We know so little about it.
The best way to protect yourself remains social distance and face coverings. Oran even recommends investing in an N95 mask, but admits frustration over the lack of supply.
3 or 4 months later, after the first cases appeared, we still do not have enough masks.
And for those who say they're not worried about contracting the virus or don't fit the profile, he offers this example.
Boy, there was a case last week that people might have heard about, a young woman in Chicago who was in her 20s in good health. She contracted the coronavirus back in April. Unfortunately, last week, she required a double lung transplant. The doctors, the surgeons said they'd never seen lungs that had been so damaged.
He also talked about the need for more testing, as we're going to be dealing with this for quite some time, at least the end of the year, early next year, till we see a vaccine. But the immediate threat is this second wave compounded by flu season. So the best we can all do, because we may be asymptomatic, is assume that we do have it.